Optician Tajetov is one of about 25 million Americans who don't have health insurance. She's researching coverage options given the experiences she has had without it.
I might not feel well, and I'll try to say, okay, well, this may not be serious, it's a cold or something not serious, so I might try to put it off because I know I don't have the insurance to pay for it if I have to go to the hospital.
The Affordable Care Act passed in 2010 under the Obama administration. The health reform law is credited with helping cut by nearly half the number of non-elderly uninsured Americans, according to the health policy organization KFF.
Created some new health insurance markets that had not existed before. And this is where people can come to buy their own insurance and get a federal subsidy to make it more affordable.
As of March, 21 million Americans had health insurance through the Affordable Care Act marketplaces. Republicans have for years tried to repeal the law. Former Trump advisor and president of the Paragon Health Institute, Brian Blaze, listed some objections.
The ACA restricted choices, increased healthcare consolidation, which is hospitals buying up physician practices, healthcare providers merging. And all of that has increased prices and spending, and American health hasn't improved meaningfully.
ACA supporters disagree. The topic is now central to the Harris-Walz Democratic presidential campaign.
He intends to end the Affordable Care Act, to take us back to a time when insurance companies had the power to deny people with pre-existing conditions.
As president, Trump tried and failed to repeal the ACA. He takes a different approach in his current campaign.
I'm going to keep the Affordable Care Act. It stinks. It's not good. If we can do something better, we're going to do something with it. If we can do better, meaning less expensive and better health care for you.
Neither the Harris nor the Trump campaign responded to VOA requests for details on how the nominees plan to improve or strengthen the Affordable Care Act. Former Trump advisor Brian Blaze supports reforming rather than repealing the ACA.
Redirecting a portion of the subsidies away from insurers and towards individuals.
For Carl Hughes, an ACA enrollee, this is personal. He urges the future occupant of the White House to keep patients' best interests in mind when assessing changes.
That their tweaking of it is going to be to improve it, not block it.
Alongside abortion rights and immigration, Hughes, an independent, says he'll prioritize the healthcare topic when he casts his vote in the November election. Veronica, Balderas, Iglesias, VOA News, Washington.